Hi, welcome to Skin by Lovely. My name is Stacey. I'm a physician assistant here, and today I'm going to show you a demonstration on how to do dermal filler. Dermal filler can be a hyaluronic acid such as Juvederm, Restylane, or Perlane, or it can be a calcium-based filler such as Radius. Today we're going to be doing a hyaluronic acid such as Juvederm. Juvederm Ultra XC is a gel-filled filler that has actually lidocaine in it, so it makes it more comfortable and pleasant for the patient. We're going to be treating a couple areas today. Most commonly, people like to do filler in their nasolabial folds, which are these little grooves right here, as well as augmenting the cheeks right here, as well as plumping, augmenting, or smoothing out the lips, or marionette lines, which is down here. Today we're going to focus around the mouth area, so we'll do a little bit in the lips, a little bit around the nasolabial folds, and a little bit around the marionette line. Okay, so let's get started. First I'm going to have her ice. Go ahead and ice around the area. She was already medicated with topical numbing cream to make it even more comfortable. She signed her consents and we took some pre-photos so we can compare them afterwards. So go ahead and ice, and I'm going to get the filler ready. So now that she's done icing, I'm going to clean out the area with a little alcohol swab. Sorry, I know the smell is unpleasant, but I need to get the area nice and clean. And do a little bit on the lips here, so we're going to clean that as well. What's nice about dermal filler is that it gives a nice, soft, natural appearance. No overdone look. We're very conservative here. You can always add more if you need more, but we always start nice and light and just restoring the youthful appearance of your look that you already have. I say it's skincare maintenance. So let's start with the nasolabial folds. So just go ahead and relax your mouth. And so when I pinch here, you can see that the cheek right here makes a little line, so that's what we're going to be filling right now. And you're going to feel just a little bit of a poke. 1, 2, 3. How are you doing? Good. And a little poke. 1, 2, 3, deep breath in, out. Great. Now when I push the cheek down, you don't see as much of a line when you do that because there's the filler right there. And she can, minimal bleeding. So it's very, as you can see, non-invasive and almost painless, right?
I really felt
and you get pretty instant results from filler. So we are going to continue on to the other side. Alright, now we're doing her left side nasolabial fold. Perfect. And now that we're all done with that, we will start on your lips. So let's see. Right now what we're going to try and do is we're going to try and even out the symmetry of them. A lot of times people have one side that's a little bit more rounded or a little bit shorter on one side than the other, or higher or lower. So our first goal is to just make everything look a little bit symmetrical, and then after that, you know, to enhance them or plump them a little bit to help soften the lines in the lip. So let's see, what we're going to do for Jen here is Her right side's a little bit more full than her left. So let's see. So we will inject the left starting there and try to even them out. Beautiful. Go ahead and put your lips together. And so we now just finished doing her nasolabial folds, and then we just started doing her, filling in her lips a little bit. And you can see how it doesn't look like fish lips or duck lips or anything like that. It just nicely softens out the lip. It's really great for if you're, have lines on your lips and, your lipstick always gets caught in between them, or you have really dry lips. It just really nicely softens them out. So there you are. So now we're just filling in her little dimples around her marionette lines right there, just to help soften the overall look around the mouth. We already did the other side there. And then the lips are done. So last thing is I'm going to put a little bit of arnica, topical arnica on, and that just helps for any redness and bruising. It's normal to have a little bit of redness from the pinpricks, and sometimes people can even have bruising, but if you take things like arnica orally and put on arnica topically, that will definitely help minimize bruising and redness. So let's put some of this on her now. We're going to just smooth out all the areas that we did, so the nasolabial fold. Feel nice and smooth around the marionette lines. And if you can open for me, and we're just going to feel around the lips here. Great. And so usually in about a couple weeks, because filler is hydrophilic, it will plump up even a little bit more. So it's always important to come back for your 2-week follow-up, and that way we can see how everything's settled in, make sure everything's even, and that way if we need to do any touch-ups, we can do that at that time after all the swelling has gone down. Swelling can last from just an hour or two up to a full day. Bruising, if you do bruise, depending on how well you heal, that can vary as well. All right. And so let me just bring you up now. How's everything?
Everything's great. Feels
good. And then let me just give you a mirror so you can just take a look.
Awesome.
It looks gorgeous.
Yes, definitely smoother. Love it.
All right.